you all. I am Dr. Nambi, Senior Psychiatrist from Chennai. I am now trying to give some highlights of what are all the psychological problems or mental health problems we are facing during this coronavirus period. Of course, there are a lot of infection related physical problems in persons affected by coronavirus. Apart from that, there are many mental health problems are there in persons affected by coronavirus and even persons who are not affected by coronavirus. This we have to keep it in mind. Mental health problems are not uncommon in children also. Children do have lot of psychiatric disorders or psychological problems. The common problems include autistic disorder, autistic spectrum disorders, attention deficit hyperactivity disorders, learning disabilities, childhood depression, mental retardation. Like that, so many problems are there in children. Now we focus on a particular specific problem called ADHD, the expansion being attention deficit hyperactive disorder. Is a very common problem in children. Around 7 to 8% of the 7 to 9% of the children, school-going children, having this type of problems. This starts from the childhood onwards, and it will be manifested during the school-going period or even earlier at home. And it is not due to any parental problem, or it is not properly the parent bringing up the child. You cannot blame the parents or society. It is a neurodevelopmental, neurobehavioral problem. So that's why we have to be very careful that some people are prone to develop this type of problem. The cardinal features of this attention deficit hyperactive disorder is very important is over attention span. They cannot attend to one thing at one time. They perceive multiple stimuli at one time. If I am concentrating in my class teacher lesson, I will concentrate there. But an ADHD child will perceive multiple stimuli. How the fan is running, who is going the other side, what is happening in the outside the classroom, what is that bird in the tree doing. All these things at the same time they observe. Their perception will be totally disturbed. They perceive multiple stimuli at one time, so they cannot concentrate anything at one time. That is why they cannot perform well in the class also. And even if a teacher writes on the board, they will write only now and then here one or two lines like that. Lot of gap will be there, they cannot complete. They cannot complete the task and they will be poor achievers in the class. And often they are scolded by the teachers because they are negligent or they are doing mischief and all. It is not a mischief, it is a problem. They have to understand. Very wise, intelligent teachers recognize ADHD, and intelligent mothers also at home recognize by third year like that. So they will poor attention span, very important. So the child will be highly restless, overactive, and cannot sit in one place. You just going here, there, jumping from the table, jumping from the thing, all these things, overactivity will be there. This is what we call hyperactive phenomena. Attention deficit, very poor attention, and overactivity or hyperactive phenomena. And other thing, important thing, they are highly impulsive. Suddenly they will do things impulsively, without any thinking or without thinking the consequences. Suddenly they throw away things on the thing. They damage the articles at home. They cannot oblige to the parents. You cannot put them in one place, and that too period like this corona time, it is very difficult to keep them inside the house, because even the normal time they will go here there. If you make them sit in second standard, they will be sitting in the fifth standard after some time. They will jump from one class to another. They will go and play with somebody and create some problem with the playmates or other children and come out. Their problem will be with the school, with the teachers, with the other classmates, and with the parents also. So sometimes they will be irritable, overactive, irritable, impulsivity, poor attention span, highly distractible, and these are all very, very, very common things which we may not miss. It is not a naughty behavior. Naughty behavior is slightly different. This is some sort of problematic behavior, a mental health problem which we have to observe and which we have to correct. But it is due to, as I told you, it is due to mainly a genetic problem, a neurodevelopmental problem, or due to some neurotransmitter like dopamine problem. All these things may be there, or serotonergic or noradrenergic disturbance may be there. But one thing we have to understand, that you cannot totally correct them in a day or two. It will be there for some years, till from 5 to 10, 12, 15 years it may last. In adolescence, gradually it will come down. And when they go to adult period, 80 to 90% of them, they will become normal. They will come to the main road. Until then, it will be a very challenging job to the parents and the school teachers. Very difficult. They are not idiots. They are intelligent. But they cannot sit in one place and concentrate on things. So, it is very important that the teacher should know that they need a different type of focus. They have to appreciate him, they have to make him quiet. You cannot punish them. If you punish, it will be exacerbated their problems. So with kind words, sometimes if necessary in a special class for ADHD children is advisable. And you have to give very little stimuli, not too much stimuli like other children. Very little homework, very little lessons. For some time they will cope up and come up very well. As age passes on, many they turn out to be normal. Only very, very, very few they turn out to be adult ADHD. During adolescence system, they will come. So many ADHD child, they become very normal in the later age group. So ADHD is a problematic thing in the house, in the classroom, or in the playground, or wherever they go. Because they are highly distractible, and their distractibility is so much, they will distract the attention of others also, and they will not let others also function properly. Wherever they are, their presence will be seen, and others cannot do their normal work. So much is the type of attention deficit and hyperactive, distractible, impulsive activity will be there. So they need kind words. They need positive reinforcement, and they need a cool environment where the commands will be less, the task should be less, and these are all some of the psychological methods of things. And you have to engage in some relaxation therapies. You have to engage in yoga or any other mind-directed activities, or you can put them in gym. Or like that, their energy will be spent out in a positive way, not in a negative way. And apart from that, wonderful drugs have come now, especially the one accepted drug. What very often we use is one drug called methylphenidate, a stimulant which definitely controls. But only thing you have to sometimes give morning and afternoon, preferably to be avoided in the night time, because otherwise night sleep will be disturbed. The methylphenidate drug has done some wonders in these children, apart from some other drugs like atomoxetine. Earlier, some people even used to give some antidepressants, even alpha-adrenergic drug, codeine will be given earlier, some time back, not nowadays much. So the main drug is now methylphenidate stimulant is much valuable in this treatment. We have to understand the child. He is more than naughty, but he is not purposely doing. He is suffering from a disease. That should be rectified. One thing you have to understand, gradually he will become normal, but you have to wait. Till that waiting period, especially the mothers will suffer a lot, the teachers will suffer a lot. But after some time, gradually, even if you start the drug, you can see the gradual improvement. The attention span will be improved, hyperactivity will be improved, distractibility will be improved, impulsivity will be reduced. All these things can happen with the treatment and side by side psychological methods of treatment. So, attention deficit hyperactive disorder is not an uncommon child mental health problem. It is not uncommon also. It is around 5 to 7% of the children. But as they grow, they become normal mostly. But this we have to recognize. We should not label them as abnormal children. We should not think that they are antisocial or other rowdy elements they are doing like that. We have to understand their problem, and a positive approach with them will do a lot of good to them. Thank you.